Hello guys, I Dr. Virendra, Associate Professor, Department of Pediatrics, MIMS Medical College and Hospital welcomes you at your YouTube channel for the medical student. So guys, today we'll discuss here about the drowning, where the objectives are definition, epidemiology, modalities of the drowning, pathophysiology, management, prognosis, cause of death due to the drowning, prevention and post-mortem changes of the drowning. So guys, drowning is defined as the process of experiencing respiratory impairment from submersion or immersion in the liquid medium. And it does not imply the final outcome as the death or survival, where the outcome denoted as the fatal or non-fatal drowning. So guys, there are some confusing terms. These are near drowning, bad drowning, dry drowning, secondary drowning, silent, active or passive drowning, which are abundant nowadays. And hypoxia is the injury which causes following the death or events due to the drowning. So guys, if the water enter into the lung is known as the wet drowning, and if there is laryngeal spasm immediately after entering the very small amount of the water, it's called dry drowning. And if there is survival after the 24 hour of the immersion is known as the secondary or near drowning, while the death resulted after the immediate immersion or within 24 hours after the immersion is known as immersion syndrome. So guys, epidemiologically, drowning is the third leading cause of the unintentional injury of death worldwide after accidental and burn injuries. And 91% of the drowning death occur in the lower and middle income countries worldwide, while the 43% of the drowning death in worldwide occur in China and India. And mortality rate is very high in male than female for the all age and reasons, as it is around 10 times higher in males than females. And children of the age 1 to 4 year of age and 15 to 19 year of age having the highest death rate globally due to the drowning. And there are different modalities for the age group, as the infants less than 1 year of age having the drowning due to the bathtub, buckets or during toilet, and up to the 1 to 4 year of age there is drowning in swimming pool, which are commonly in the household communities, and bathtub or nearby pond or any river having drowning. Or in school going age there is slightly large swimming pools, or during the boating open water sites as lakes, pond, river, where we can go to the visiting. And adolescent is having the greater risk taking behavior, or they may use the alcohol, so the natural water reservoirs having the modality of drowning. There are some underlying conditions which may cause the drowning, as the epilepsy, long QT intervals, ventricular arrhythmia, alcohol using, water sports activity or recreational activities are the modalities for the drowning. And pathophysiologically, when a patient submerges airways below surface of the water, the patient or victim attempt to come to the resurface and struggle for this, and voluntary he attempt to protect the airway and hold the breath, but due to the holding this breath, involuntary attempt to inhale the oxygen and gasping condition is likely, which may cause reflex swallowing of water into the trachea and lungs, which cause respiratory failure. Ultimately, the asphyxia or hypoxia may occur. The hypoxia or asphyxia may leading cause of systemic injury, as in pulmonary system there may be secondary apnea or aspiration of the water or liquids, or there may be hypercapnia. And in centrally there is some anoxic damage of the brain, and there may be some defective autoregulation. Due to the hypoxia there may be cerebral edema or raised intracranial pressure, and cardiac changes may be there due to the myocardial ischemia, and fibrillation may occur after the cause of hypoxia. And renal cause, they may be acute tubular necrosis or acute cortical necrosis due to the hypoxia. So guys, there may be hypothermia due to the cold water, and there may be some water overload. In hypothermia, there is cardiac arrhythmia, and hypothermia may cause vasodilatory effect. Due to this, decreased intracranial pressure and blood pressure may be low, and CNS effect may be there is reduced metabolism along with the reduced intracranial pressure, and the vasodilatory effect may cause renal failure, and all of these cause may at death of the victim. And another pathophysiology is the water overload may cause the systemic effect, as in the lungs there may be alveolar fluid, and there may be some acute respiratory distress syndrome or pulmonary edema, and there may be hyperventilation. And central nervous system may cause there is cerebral edema or increased intracranial pressure, and in GIT there may be some gastric distension along with the vomiting, aspiration or ileus. And dilutionary effect may cause some dyselectrolytemia, as hypokalemia, hemodilatory effect or hemodialysis may be there. So guys, when a patient come to you with the drowning, we should manage the patient at the site of scene, and pre-hospital management is very important. Thereafter, if the patient come to the hospital-based management, emergency, cardiorespiratory, neurological, hypothermia and other treatment to be done in the hospital. As the site of the scene, where pre-hospital management goal is the reverse the anoxia or prevent the secondary changes or secondary injury due to the hypoxia. And we should start the management at the site of scene, and if the patient is conscious, we should evaluate the aspiration. If there is no aspiration, observe the patient, and if there is aspiration, we should give the 100% oxygen to the patient. And if the patient is unconscious also, CPR can be done at the site of scene, and mouth to mouth respiration can be given with the 100% oxygen, and patient should be transferred to the hospital with the continuous CPR and mouth to mouth respiration, and establish the airway, remove the wet clot to prevent the hypothermia, and if there is chances of the cervical injury, we should immobilize the cervical spine. And when patient come to the hospital emergency, we should assess the patient and manage the airway, breathing, circulation. ABC management is very important in this child, and should take the acid blood gases, blood sugar to be taken, electrolytes can be sent, and chest x-ray to be taken. And observe the patient in the emergency department at least 4 to 6 hours. If there is submersion is more than 1 minute, if cyanosis after the extraction or CPR had done any side of the scene or in the hospital, and we should manage the hypothermia along with the ABC management. And after the 6 hours, if the patient having the GCS score is 13 or more than 13, patient having the general physical examination is normal, respiratory fat is normal, and oxygen saturation on the room air is more than 95%, we can send the patient home safely and discharge. If there is not maintaining these parameters, we should shift the patient to the ICU for the further management, and there may be intubation required, where if there is indications of the intubations are, if there is saturation is less than 90 at the FiO2 60%, or hypercapnia along with the acidosis or respiratory acidosis there with increased work of the breathing, and if there is CNS examination is abnormal. And we should also manage in the ICU hypothermia as rewarming the patient, hypoglycemia with giving the fluid and sugar, and shock to be managed along with the giving the fluid, and inotropes may be required. If there is raised ICT, we should manage it with the mannitol or 3% normal saline, along with maybe in special condition hypothermic cooling may be required. ARDS to be managed with the high PEEP ventilatory effect, and dyselectrolytemia should be managed, as a hypokalemia should be managed with the potassium supplementation, and if there is any injury, it should be managed accordingly, and if there is secondary infection, we can use the antibiotics. And other managements to be taken as if there is acute respiratory failure, diuretics, fluid resuscitation and dialysis may be required. If there is profuse bloody diarrhea or mucosal sloughing, bowel rest to be given, nasogastric suction can be done, and gastric pH neutralization can be done by the ISOG. And in the half of the patient having drowning fever, which is not due to the infection, it may be due to the inflammatory cause, and antibiotic prophylaxis is not recommended in this condition, and only paracetamol or antipyretics can be given. And prognostic factors are for the drowning: if death or severe neurological sequelae in the patient of the drowning with the deep coma, if there is apnea, if there is absence of the papillary response, or if there is hypo or hyperglycemia, if there is submersion duration is more than 10 minutes, or failure of response to the CPR given for the 25 minutes in the emergency, that is the bad prognostic indicator for the drowning. And cause of death in the drowning is asphyxia, ventricular fibrillation due to the disturbed sodium-potassium ratio in the freshwater drowning, and laryngeal spasm may be there, and vagal inhibition due to the cold water shock, emotion or unexpected immersion, exhaustion may be there, and injuries of the skull or cervical vertebrae may cause death. And post-mortem signs of the drowning as are washer woman's hands may found, fine frothing or pink frothing from the mouth, cadaveric spasm may be found, and subpleural hemorrhage as polytopes spots may be found, emphysema, aqueous or heavy lungs may found, or diatoms may be found in the trachea or other part of the body. So guys, prevention from the drowning is very important modality, and child never be leave alone in or near the water. We should supervise always and remove the potential hazard if there are, and lifeguard activities to be taken where the swimming or nearby is the water ponds, river or any water sites. And in the community we should educate the prevention of the drowning with the CPR or mouth-to-mouth rescue. And in the patient of epileptic children, we should supervise the swimming and leave bathroom unlocked during the bathing. So guys, this is all about the drowning. So guys, if you did not subscribe our channel, subscribe the channel, press the bell icon to get our notification first, and share this video to all the students who require this, and like the video and comments in the comment section. Thank you very much. We will meet again with the next topic. Thank you.